and thank you very much.
That was a wonderful presentation highlighting the features of the product, and it really is very exciting to hear how you're putting this to work. I'm going to share my screen momentarily and bring up the introductory slide for Dr. Brader. And Dr. Peter Brader who is a medical director at the Diagnosticum Group, a research fellow at Memorial Sloan Kettering Cancer Center, and an associate professor at the Medical University of Vienna. And he's going to talk to us about how he gets time savings using CoLumbo in the clinical practice of interpreting lumbar spine MRI. So Dr. Brader, I'm going to stop sharing, and that should give you the opportunity to share.
Thank you very much, Larry, for this very kind introduction. Also from my side, a good evening from Linz. I'm today in Linz. I will tell you a little bit about the Diagnosticum groups. I think we're the biggest private MR and CT imaging group in Austria. We have different locations in Vienna, Graz, Schladming, maybe you know from skiing, in Traun, and I'm sitting today in Linz, and then I will share my first experience because we have personalized CoLumbo and the software for our institutions and not only for our PACs, but we are also extracting the report and put it in our RIS system. And I will try to share my screen now, and we'll show you first in a few slides how we do it, and then I can also hopefully share my screen with my working station and show you a few cases how we report with CoLumbo. Can you see the slides? I hope so. Okay, first when I open via the RIS system, when I first open a lumbar spine, then I use two screens. So you have the screen here on the right and the screen here on the left, and then it opens in an H sharing where you see the T1 sagittal imaging, T2 sagittal imaging, T2 transversal imaging. Then we have also a coronal TIM image with the Mueller sequences, and here are the first results also from CoLumbo. So the first thing, what we do is to organize our screens so that you have the T2 weighted imaging here on the left, the sagittal, the transversal view. Then you have, because we're using a beta version, we have this for clinical use from CoLumbo, also T2 weighted sagittal view and transversal view. Then the T1 weighted image is the T2 TM image, and then since we also use a beta version, we have also the results from the not for clinical use. The next step is very important, that you also synchronize the images, and for our PAC system we have here this button that we can all synchronize all sequences, which is very important because then you're always on the same level with all the images. So for the T2 weighted imaging, and also for clinical use and not for clinical use. That makes it easier for us to report. In the next step, we have developed a small program which extracts the report from CoLumbo, which comes also via our PAC system. So we extract from the DICOM data a report, and this here is the report that comes out for us. And you see, we use, of course, a German report. So this is the German report that comes out of the system. And in the next step, we have a copy and close. So you copy the whole text and close this window, and then it goes directly into our reporting software. So you can see here our reporting software. This is our editor where we can dictate and change everything. So the whole report goes into this system, and then you can either write here something, or you can also delete something, or you can dictate something. And at the end, you're nearly done with the report, and it also not saves only time in the reporting, it saves also time for the people who write the report, who have to format the report and everything. I did a small time-saving study in 20 patients, reporting with or without software, and what you can see here is percentages in time saving. So you have time saving up to 40–50%. On the other hand, of course, you have also time saving, which is not very good. But these are unsuspicious cases, so there is nothing to report. And here, when you also dictate a report, then it's very easy, since we also experience. So I do approximately 25 to 30 lumbar spines every day. So all in our group are very experienced in reporting, very fast in this. So I think this time saving is very interesting. And so we approximately around average around 15%. So now I will stop sharing this screen, hopefully. Now you can see me again, and now I will try to share my working station. Hopefully this will work also. So hopefully now you can see my workstation. And for example, I have here chosen 4 cases for CoLumbo. I have, of course, to analyze the data so that I can show you the data from our working station. So we start here with one of the cases. The first case I want to show you is this one. So we start here in our RIS system. So I open the report in our system. Then it hopefully opens also in our PACS view. For example, here you can see still our small program already extracted the report from the DICOM data. So this is really live. There is nothing prepared. This report now is in German, and now I will organize my images like I said to you. So this is CoLumbo. This is CoLumbo. This is the T2. And here's my T2. This is what I said to you first. So now the images are not synchronized. So in the next step, we synchronize the images. And then here you have the synchronization of the regular T2 weighted images with overlay from CoLumbo as well. And also you can see it here that all the images are synchronized. And then we can go on the level, and you can see here, like Professor van Gotten said before, that you have the measurements. I will make it a little bit bigger. So here's the measurement, 7.5 millimeter on sagittal, and also here that you can say the detachment of the nerve root. So this is a small line, but then when you have connects between the nerve root and the extrusion, you can see here CoLumbo is using here a big line. So if this fits for us, I go back to our wrist system, and you see when I copy and close, everything comes here, and you can delete something here. You have an impression if you don't like to impress. So we choose to use segmental reporting. So you can see here from T1 to T2, no significant degenerative change. Some people like to have an impression, yes. Some people don't want to have it. So if you don't want to have it, you just delete it from here. If you don't want to have T1, T10, T11, T11, T12, you can also say, okay, I just want to have the lumbar spine. So you can change everything here. And also if you add one something, you can also say, okay, let's add it here. Our software is working in German, so unfortunately I cannot dictate in English, but I can write something here. And then the report is ready. I close it. Hopefully it works. Yes, I close it, and the report is gone. And this is how we integrated the software algorithm and also the reporting in our software. I can show you another case. I think we have time for another case also. So again, you choose a patient, you open your RIS system. Then, of course, I have not synchronized the patients because they're anonymized. So, okay, 3. Normally, this works automatically, but since the patient is anonymized, I have to do it by myself. So again, CoLumbo images, regular D2 images, synchronize everything, and then here we go. You see here the measurements of the bulging, then an extrusion. You have also a listhesis, and here is already, because it's live, here's the report that comes from the system extracted from the DICOM data in German, since we use German. Copy and close, and then you go back to your reporting software. And then, for example, here it's now here's in German, but I have the report also. It's case 3. So you have it here also in English. Now, and here again, you have we have decided to go for general findings. Then we have the MR findings, and then you look at the report and you check it, what you see on the images. For example, here the report says, I think it says symmetric. So for example, here I would change symmetric in the left paramedian. Oops, left paramedian. Then you look at the retrolisthesis if you want to keep it for the measurements. So you can either keep it or you can delete it. Oops, sorry. And then again, you end your report and you're done. So if you want, I have one more case, maybe one more case I can show you. Let me choose case 2. Again, you open your patient. Normally the PACS images will come up. Here is your patient, CoLumbo. You have to rearrange it a little bit. The CoLumbo image, the regular T2 image, CoLumbo image, and the regular T2 image. You synchronize your image, and here on the other screen, you already have your report ready. Copy and close it, and it goes automatically to your reporting software. For now, I have to do it. this way because I have to use the English text for you, not the German one. The German one goes automatically into the report. With the English version, I have a little bit to change it a little bit. And again, you have here findings. We have the general findings. We have the MR findings. And also you can look, for example, here you have a severe right extraforaminal disc protrusion, especially when you're not so experienced, L2, L3. You can see here on the left side, the foramen is regular, but when you go on the right side, you can see here this this foraminal extraforaminal disc protrusion, and especially when you're not experienced, it's easy to miss. So you look again at your images. You can also see it here, the measurements. And you have here a disc bulging. The others are no relevant findings. So you go back to your report. You can say, okay, if you don't like severe, you can delete severe and only say right, not severe. In the other segments, you don't have significant changes. In L4, L5, you saw this mild symmetric bulging. You had it here. It's mild, and the others, you have no significant changes. And then you're again ready for the report. And this is what really saves us a lot of time, because we have regular in our group, we have around 12 MR scanners in whole Austria, and I think we do around 100 lumbar spine. And when you calculate this with our first result with this version of the software, not with the versions that are coming, you can really save up to 50-25% of time in an experienced setting. And as Johan first mentioned, that you will even save more time when you're in an unexperienced setting. So I think hopefully I could show you a little bit how we work with the software, how we integrate this in our system. And this is really one of the benefits of the software, that you can integrate the whole software, not only in the packs, but you can also extract the report in different languages and put this in your reporting system, I think. And this is really one of the great benefits of the software. And now I will end this screen sharing and give the moderation back to Larry. And I say thank you for having me with you this evening, and I hope I could show you a little bit of our experience.